Hey, and welcome to The Explainer. You know, every doctor's journey starts with one single profound step. And it's not about learning some complex disease or a miracle cure. It's about learning a whole new language, the language of the human body. Today, we're diving into the very first chapter of that story, anatomy.
So, to really get into this, let me ask you a question. What do you think is the very first truly profound lesson a medical student learns on their way to becoming a doctor? I'll give you a hint. It has nothing to do with a specific disease or a drug. It's something way more fundamental.
Well, the answer is learning to read a map. But not just any map. We're talking about the most complex, most incredible map that exists, the map of the human body. And anatomy? That's the first guide, the foundational chart for the entire incredible journey of medical training. Okay, so let's really unpack this idea of the human map. I mean, think about it. Before you can fix anything or navigate any new place, you absolutely have to understand its layout, right? That is exactly what anatomy provides for a future doctor. So what is anatomy, really? Well, at its core, sure, it's the study of the body's structure. But the part that's really key here is the second bit, the connections between its various parts. It's not just about memorizing the names of bones and muscles. It's about understanding how every single piece is intricately, beautifully woven together. Now, when it comes to reading this map, medical schools actually teach it from two totally different perspectives. You can kind of think of it like this. It's the difference between learning a country's entire highway system versus exploring one specific city, neighborhood by neighborhood. Let's break this down a bit. So on one hand, you've got systemic anatomy. This is like tracing the entire cardiovascular system, every artery, every vein, all throughout the whole body. But then you have regional anatomy. And here you just focus on one area, like the head and neck, and you study everything in it, the bones, the muscles, the nerves, the vessels, all at once. And that regional approach is so important because, well, that's how a doctor actually sees a patient in the real world. But, reading about a map, that's one thing. Actually exploring the terrain for yourself, that is something else entirely. And that brings us to, arguably, the most significant part of learning anatomy, the moment that 2D textbook page becomes a 3D tangible world. And this is the thing, right? The gross anatomy lab is where it all finally clicks. It's the place where students take all those diagrams and lists they've been memorizing and finally transform them into a real three-dimensional spatial understanding of how the human body is actually put together. This is where it all gets very, very real. And this whole exploration, it's not just random. It's this incredibly methodical expedition, a literal journey through the human form. As you can see, students usually start with the face and neck, then move on to the limbs and back, before they delve deeper into the organs of the chest and abdomen, and finally the pelvis. Each step just systematically unveils the body's layers, building knowledge from the outside in. But the map isn't just what you can see with your own two eyes, right? Anatomy also requires a super powerful zoom lens. Students have to dive into histology, which is looking at tissues under a microscope. They study embryology to figure out how we develop all the way from a single cell. And they tackle neuroanatomy, tracing the unbelievably complex wiring of the brain and nervous system.
But the anatomy lab teaches lessons that go so much deeper than just science. It really forges the character of a future doctor. This is the place where students learn not just about the structures of the body, but about the weight of humanity itself.
And this slide really gets to the heart of it. Students learn this profound respect for their silent mentor, the person who so generously donated their body to science. They learn to work as a team because dissection is absolutely a group effort. And they learn emotional resilience, confronting the realities of the human form head-on. And that's not just about getting through the lab. It's really the first step in learning how to handle the incredible emotional pressure of caring for patients. And that really brings us to a simple but very profound truth. For so many students, the anatomy lab is their very first direct encounter with mortality. It's a humbling, sobering, and deeply formative experience that prepares them for the immense emotional weight of the careers ahead of them. So why? Why does all of this matter so much? Why is this first map, learned through books, models, and most importantly, the lab, the absolute, unshakable cornerstone of medicine? Well, it's because without this map, modern medicine is pretty much impossible. Think about it. A surgeon is relying on this knowledge second by second to navigate the delicate space between life and death. A radiologist is using it as a mental blueprint to interpret every single shadow on a CT scan or an MRI. A family doctor uses it to connect a patient's story of pain to a precise location on this map, turning vague symptoms into a real diagnosis. It is, without a doubt, the bedrock of every clinical skill they'll ever learn.
And so it all comes down to this one fundamental truth. Anatomy isn't just another course you have to pass. It's the language of medicine itself. It's the first map, the first lesson in our shared humanity, and it's the foundation upon which every single healer is built. It really leaves you with one last essential thought, doesn't it? If a doctor can't read the map of the body, how can they ever hope to guide their patient back to health?